Hey everybody, good afternoon, good evening.
Hey.
We are here at Bodyworks Physical Therapy and Concussion Center, and I am Cody Barnett.
And I'm Dr. Doug.
Good to see everybody. Glad you could join us tonight for the webinar. And we're going to be covering a lot of fun things in relationship to neck pain and upper back pain and things like headaches and neck stiffness and so forth. We've also got a couple of our coworkers that are behind the scenes. We want to say thank you to Melissa and Karen who are helping us. So
thank you.
If you know Karen and Melissa, be sure to give them a little thank you in the comments there. And
so yeah, if you can hear us, give us a thumbs up. Say yeah, you're okay. Volume, stuff like that. So sometimes with webinars, you can see them, but you can't hear them. I was on one on Zoom on Friday, and it was in and out. So just let us know. Welcome. And if you guys have questions about necks, type them in the comment section. Okay, because we want to get your questions answered, so you guys can take the next step forward on what to do if you're having some neck issues, which we see a lot of. I mean, I saw 1, 2, 3 today. So they're all doing better, moving better. So yeah, very common thing.
Mm-hmm.
It's like low back pain. You just see neck pain. You know?
Probably one of the most common things that we treat.
Yeah. And there's a ton of things you can do. I mean, a ton of things. So it's really nice. You're not stuck just taking 800 ibuprofen, 800 milligrams of ibuprofen 3 times a day, or heating pads and stuff like that. So there's a lot that you can do. So I like seeing neck pain patients. It's kind of fun.
Yeah. So we're going to start tonight with a story, and the story is about yours truly. About a week ago, I started getting this nagging little ache in the back of my neck back here. And over the course of the next 24 hours, it just got tighter, and such that I could not turn my head more than about here or about here. And we're going to be talking later on in the talk about what was wrong with me. But suffice it to say, I was kind of jacked up, okay? And so I'm having trouble like turning to back the car out of the driveway. I'm having trouble, yes, I'm doing one of these to back the car out. I'm doing one of these to look at traffic. And then I'm working with clients, and I'm having to make sure I'm straight ahead of them. I can't be off to the side. But anyway, the cool thing is that the next day we were both booked solid, and so I was lucky enough to call Dr. Doug that night and say, hey, can you come in a few minutes early and work on me so that I can be healthy to work on our patients later that day. And so Dr. Doug worked on me, loosened up my middle back, my shoulder blades, my neck, a little bit of stretching and a little bit of joint mobilization, and my rotation improved by about 50 to 75%.
Like Emerald of gas. Bam. Boom.
It went like that. Anyway, thank you. So improved quite a bit, and then I had an exercise that I needed to do to keep that mobile, keep that moving throughout the day, which I did about every couple of hours throughout my workday as I was seeing patients. And lo and behold, I had to continue that for several days actually after to keep things moving and loose. But by the end of the week,
bam.
And
neck
so
works.
Got full range of motion and feeling great. So where we're going into that though is that there's so many people that we see, they start out with a history and a story that's just exactly like mine, but because they're unsure or they don't know what to do about it, or they don't know what's going on, they don't know how to take care of it, because they don't know, they basically do nothing.
It just spirals down. It spirals down. It gets tighter and tighter, tighter and pain, tighter, more pain, tighter, more pain, tighter, more pain, and they come in and then they start having secondary issues, headaches, upper back, arm issues, and so you got to kind of weed through all that stuff to get down to what's the root of the problem, and that's that's what we do. And as physical therapists, we know the insider trader information on what to do. So Cody says, hey, can you work on me? I said, yeah. Boom, he's stiff, so we had to work on these upper back. Upper back's related to neck. We'll get to that. Okay, so understand, the first takeaway is your upper back relates to your neck. Okay, so here's I'll just do a demo. Watch. Okay, when I slouch, so your neck has three ranges of motion: front, back, side to side, and rotation. Okay. Now, when you take up motion in one direction, you lose the other two. So watch this. If I slouch, watch how far my head turns. Right there. It stops. Now watch what happens when I straighten up in my posture. Watch what happens to my neck. I'll straighten up. Boom. Okay. So when your upper back is flexed, you lose motion in your neck. So we're slouching on our phone, stuff like that. So just understand that upper back relates to your neck issue. So that's your first takeaway for that.
So now I'm completely off. I don't know where you went off the script.
I went off bunny trail. This is good.
But anyway, so what I was saying is that a lot of people come to us with a similar situation, but because of uncertainty and not really knowing what to do about it, they end up, it's 2 months, 6 months, 12 months, 2 or 3 years after the fact, and they've been continuing to deal with this. And so that's what we're going to talk about tonight is, okay, how can you break into that cycle, do something about it?
Just call us.
Well, that would
just
be
call us.
That would be
just
one
come
thing.
in like the second day. Just catch it while, a weed is easier to pull when it's little than after the weed's gotten this big and has a big root system. Okay? I was out pulling weeds in my garden this morning at 6:30, and the little weeds are easier to pull than the big weeds. Catch it early. Just call us, even just for an assessment. We have people just come in and just say, hey, can you take a look at this and tell me what I need to do? Yeah, sure, come on and take a look. So do it while it's small and just getting started, and you'll not have to deal with a whole lot of downstream issues.
So here's our agenda for the webinar tonight. We're going to be talking about things that cause neck pain, neck stiffness, shoulder blade stiffness. We're going to talk about how that then can contribute to headaches. We're going to be covering things like, why does my neck creak and crack when I turn it? Okay. We're talking about why we get pain when we sleep. We're also going to be giving a couple of giveaways later at the end of the webinar. So we're going to be covering that as we get deeper in, and then we're going to try to wrap up here between about hopefully 6:30, 6:45 at the latest. Depends on how many questions everybody has.
Yeah, type the questions in.
So if you got questions, be sure and be typing those in so we can address them as we get there.
Yep.
So if you want to take it away.
All right. People come in with neck problems, and they want to know basically two things: what's going on and why. Really, and that's why you go to the doctor. What's going on? Why am I in this condition, and why is it happening? Okay. The other question is, why am I still suffering with neck pain after it's been going on for 6 months? I've done all these other things. We see that a lot. You go from neck stiffness, neck pain, then you get into all kinds of other things, and eventually you get into the whole pain management and the epidural stuff, which a lot of times that's not even needed if you catch it early. Sometimes why people can't sleep at night. They have, their neck just bothers them at night. And so I think one of the things is we see with neck issues is there's lots of different root causes, and some of them, one of them where I talked about is posture. Okay, one of the other things is breathing. Okay, and so I'm just going to kind of go on a little blank trail about breathing. If you take a deep breath, okay, try to sit up straight, take a deep breath, and not let your shoulders raise up. Okay, so try this. Take a deep breath through your nose, and your shoulders can't move even a squilla inch. Okay, a lot of patients can't do that. They do this. They take a deep breath, and their shoulders raise up. Okay, remember your first primary breathing muscle is your diaphragm. When you see a baby breathe, what do you see move? Their tummy moves. Okay, and so, but what do we do? We got to suck our gut in so we don't have the pooch, so we don't look fat, and So what we do then is we pull this in, and we make all these secondary respiratory muscles work all day long. We take about like 10,000 breaths a day. So think about it. If you're doing 10,000 breaths a day, you're doing this. Using all these neck muscles, upper back, shoulder muscles, just do 10,000 reps a day. How might your neck feel at the end of the day? Stiff and sore. And let's do it the next day, and the next day, and the next day, and the next day. So one of the things that people can do is just actually start breathing with their stomach and letting these muscles just relax to help relieve some of their neck pain. That's one of the reasons I see with a lot of neck issues is why do I have this? One was posture, and two is breathing. And sometimes it takes a while for people actually to retrain their bodies to actually breathe normally. You know, here's what should happen. You should do this, you should do this. Okay? Just let it hang out. Okay? Don't worry about it. Who cares? Just let it hang out. It saves your neck. Okay? So, a little visual there. I show all my patients that. They go, okay. And you know what? It takes some pressure off their neck, and the neck starts getting better then because it can actually rest. All right? So, that's one of the things. Why is this happening to me? Why am I still suffering from things? I think Cody hit it on the head where people just don't know what to do. And so you go into, you're just nervous. And sometimes you don't want to make the wrong decision, so you don't do anything. That's just fear. Fear always makes you retract. And so it kind of stops you in your tracks. It doesn't allow you to move forward and take a step to get help. You know, the Bible says that there's wisdom in many counselors. So when you get stuck, you kind of have to ask for somebody for some help to say, okay, what's going on? I don't have any perspective on this. You know, what do I need to do? And that's why I said earlier on, just call us. Just say, my neck, I woke up, I can't move my neck. Getting here quick, we can a lot of times take care of things really quick, as opposed to 6 months down the road when now we gotta get to the root of the problem. We gotta kind of calm these other secondary issues down. Does that make sense? And then like sleeping at night. Well, that's like the $64,000 question. You know, that rolls into how you sleep, your posture at night, your bed, how old's your mattress. The record. 42 years.
Oh, golly.
I had a patient who had a mattress that was 42 years
gosh.
old. Yeah, I said, you're going to go get a new mattress this weekend. Yeah, she had some back and neck problems. She got a new mattress, guess what? Her back started getting better, her neck started getting better. So, sleeping, and we're gonna talk about some pillow things because that's pretty important for you to get a good night's sleep. If you don't get that stage 4 REM sleep at night, your body can't heal. If you're constantly getting partially down, you're waking up, partially down, waking up, you wake up tired, and your body cannot heal from the previous days. 10,000 breaths using your neck muscles. So those are just some things about.
Well, as long as we're on sleeping, let's just tackle that.
Yeah.
So this is one of the things that we've found to be quite helpful. I've been practicing for 29 years. For 29 years for 28 years, I searched for a good pillow for my patients. And last year we finally found it. And these are made in the Netherlands by a company called Pillowwise. If you look at it from the side, it's got a built-up area right through here that sits underneath your neck that supports that, depending on if we change the position of the pillow if you're on your back versus on your side and so forth. There's actually instructions.
Actually, we measured you.
We're like
I did one today, and I'm like a tailor. I got my little measuring tape, and I'm measuring my patient, and I'm measuring it because then we put that into a website, and then you also ask.
So we measure 3 locations.
3 locations, and then how you sleep in your mattress type. And it has an algorithm, and it kicks out the right size pillow for you. That way, your pillow it's like a custom suit for you for when you sleep.
It's like buying shoes.
It's like buying.
You don't buy the same size shoes.
Yeah.
Why would you buy the same size pillow?
Yeah.
So this is a memory foam material, straight from the Netherlands. They actually have a 30-day guarantee on it.
Yeah, you test drive it for 30 days. You don't like it, bring it back.
Yep.
That's kind of nice.
So one of the things that we're doing tonight is at the end we're going to be giving one of these away.
Yeah. Guess how much it costs? A lot. But it's worth it. Tell me how much.
$119.
$119.
And if you think about it, we spend a third of our life sleeping.
I have patients that have 20 or 30 pillows.
Oh, I've heard that too.
Literally, 20 or 30 pillows. Yeah. And they're just like, oh my, throw that one in the closet, throw that one in the closet. Yeah. I have one patient. She probably has, this is no lie, probably 50 pillows. I ran to her, she has some neck pain, I worked on her, got her neck moving, and she was going through the whole pillow thing, and I ran to her over at Dylan's. I said, how's your neck doing? She goes, oh, it's much better. I said, what'd you ever figure out for a pillow? She goes, you know what I did? I said, what? She goes, I grabbed the crummiest pillow I had, just crummy. I wadded up, I threw it underneath my head. I said, does it work? She goes, perfect. Okay, I mean, whatever works. So I think we've this is kind of step up from the wad the crummy pillow up underneath your neck and throw it underneath your head. So it has something that fits you and the position you sleep in to help you sleep better at night.
So we were just having this conversation with my niece a week ago. I hope she's watching. She better be watching.
Yeah.
Because it can be really helpful. So anyway, at the end of the webinar, we're going to be giving one of these away.
Yeah.
So hang with us. Next thing we're going to cover is, and I hear this like literally every day, is why do I get these Rice Krispie noises in my neck when I turn my head? And so that's really common. Like people just, they kind of freaks them out a little bit. Sometimes it can be painful. Most of the time it's not. Mm-hmm. And basically what that Rice Krispie noise is simply the joints in your neck rubbing over each other. Mm-hmm. No different than a knee. My knee makes a little bit of crackling noise in it, or a shoulder that might make a little crackling, or a little bit of crackling in your knuckles. And so for the majority of us, it's really not a big deal. It kind of freaks us out more, and because it's close to your ear,
you can hear it.
You hear it more,
inside.
And so that's why it makes it a little bit scarier, okay? But in reality is, for most of us, it's just like wear and tear.
It's like it's called crepitus.
Yeah. And you know, as we put a few miles on, we get a few more creaks and cracks.
You're so
well.
nice.
But
you're so nice. We're getting older.
Yeah. Now we're going to differentiate that with the person that gets that bad crack or creak, and it's an ouch. Is it a painful ouch?
Oh yeah,
painful creak?
Yeah, can't do it.
So if it's a painful thing, that's something that we need to evaluate.
Yeah.
If it's just a little bit noisy, my response is it's really good. That means things are moving.
Yeah. Turn the volume up on your radio.
Yeah.
That way you don't hear it.
Yeah. There we go. The other thing we get a lot is people will say, how come I've shrunk? Why have I shrunk? Mm-hmm. You want to hit that?
Water. Okay? Your discs, let me show you this. I was watching the sports medicine symposium this weekend, and BJ Lahecki, who's a PT, I put the PT school, talked about this. And he talked about your disc heights, and what happens is you're going to shrink about 0.7 inches, 0.7 of an inch during the day, okay? Because your discs, they dehydrate. When you lay down at night, they rehydrate, and so you're actually a little bit taller in the morning. And then when you get up and go, gravity takes over, and you'll actually shrink about 0.7 of an inch throughout the day. Okay, the discs have water in them, and what happens is if you compress these a lot by doing either hard labor or just even slouching increases compression forces. You're going to start, it's like wringing a sponge out, and you start losing height in your neck. Okay, and there's a couple places where you see the kind of the fulcrum points. It's C5, 6, and L4, 5. Okay, C5, 6 at that juncture. If you have poor posture and you have less motion in your upper back, you start to, the forces get angled at C5, 6, and so basically it starts getting smaller, the disc height. Okay, and you basically wear it out. The trouble with that is if you see how this works, how the body works, for every nerve root here, okay, here's the nerve root. I don't know if you can see this or not. For every nerve root, there's a hole, okay? Half the hole is made up of one vertebrae, other half of the hole is made of the other vertebrae. So it looks like this, okay? Nerve root comes out. Now the disc is the spacer in between, okay? So if you have a nice big healthy disc, you have big space, you have big hole for nerve root come out. What happens if your disc space gets degenerated and you don't take care of things? That disc height will get smaller, and guess what happens to the hole? It gets smaller, but the nerve cell has to come out. So if the hole gets smaller, and you have the nerve root, you have a higher chance of that nerve root getting pinched, okay? That's what sends pain like down in your neck, between the shoulder blades is a big thing. When I see people, they go, I got this thing underneath my back, upper back shoulder blade, like deep underneath there. That's neck. That's where the neck refers pain to. And when you start to work on this, the shoulder blade pain goes away. So that's a referred pain pattern. But you don't know that. You think it's something between my back, between my shoulders. It must be in my back. No, it's actually a referred pain pattern. And so that's how the body works. So that's why you want to have good posture. You don't want to slouch, because also when you slouch, when your head comes forward to your shoulders, for every inch that it comes forward, you're increasing about 10 pounds of compression on your neck. Okay? Yeah. Boom. And you wonder why you're losing height, because you're doing this, and this big old noggin of yours, it weighs about 10 to 11 pounds, is just compressing on all this. And then let's do this. Let's breathe like this and have all these neck muscles that attach here and attach here. They're just compressing things. So you have several things working for you of why you can change heights throughout your lifetime. So does that answer that?
Yeah.
Does that make sense?
How about everybody watching?
Does that make sense?
Does that make sense?
Type your questions in. We need some like Seinfeld stuff here. Come on. Just some interaction.
Now your patient with all the pillows is watching.
She is?
Oh, she is.
Yes. Thank you for the material. Appreciate it.
Do we have some questions?
Do you have any questions?
So far.
Okay.
Okay.
All right. That's cool. All right. So what we did is before, over the last 2 weeks, we've actually been having patients either write down or email us questions. So we're gonna make sure we cover all of those that we've already gotten.
Yep.
So okay, you talked a second ago about that pain referral pattern down into the shoulder blade.
Yeah.
Okay. The other pain referral pattern that people can get if they have a nerve pinched up in here is you can sometimes get zingers that go down into the arm and hand.
Right.
Okay. So if you're ever getting, I call them zingers, but it might be zingers, it might be a deep ache or a throb that goes down into here or into the hand or anything like that. Numbness, tingling, those sorts of things. That can be indicative of one of those holes that Dr. Doug was just talking about, where that's putting some pressure on the nerve and can cause some zingers.
Yep.
The other thing that can refer some of that pain down into the arm is just plain old simple, what we call trigger points.
Yeah.
A trigger point is what you think of as a knot in the muscle, and very well documented, very common that those trigger points will refer pain. In fact, there's actually been a couple of scientists that studied these several years ago, actually mapped out all of the pain referral patterns. And so that's one of the things that we differentiate and access. Okay, is this a nerve being pinched problem, or is this a pain referral pattern from an irritated trigger point?
Can I show them the interest on this one?
Yeah.
Okay. Okay. People come in with neck pain. Okay. There's a muscle right here on the back side of your shoulder blade called your infraspinatus, and you push on this, and it has a pain referral pattern in several different places. One to the front of the shoulder, down the arm, but the other place is here, up to the neck. So they come in complaining of neck pain. I go through their neck and their neck's fine, but I get on this and they go, oh my God, I didn't even know I was sore there. And so you work on that, and guess what that relieves the neck pain. So I see that all the time. I mean, literally, if I see a neck pain patient, I'm looking at that and probably treating it, because it's part of the players that give people problems.
Absolutely.
So, yeah.
Okay, Lauren wants to know, are there exercises to loosen your neck that you can do by yourself?
Yes.
Good question. Excellent question.
Yes. Can you take it? Or you take it?
Yeah. Do you want to cover it? We can cover this at the same time.
Okay.
Yeah.
Okay. Posture. Okay. Exercises. There's several different things. One is just doing a chin tuck. Okay. Now, what you're going to do is you're going to make this. You're going to make what's called your waddle. It's like on a turkey. Okay. We're just going to call it for what it is. We're just going to let it just the pooch and the waddle. All right. Tonight. You're going to tuck this, because what that does, I'll show you. If you slouch, basically what you're doing is you're compressing all this stuff in the back of your neck. You're compressing all those joints. When you tuck your chin, what that does, that helps to open things up and take pressure off those facet joints and actually opens up the holes where the nerve roots attach. Okay?
Makes more space.
Makes more space, because when you do this, these are compressed. When you tuck your chin, it opens things up. I had a gal today who's got some shoulder and neck pain. That's one of the things I showed her. I said, make this thing, make the waddle, but that does, it helps take pressure off your neck. Other things like doing the doorway stretch. Doorway stretch, because here's what happens. Some people try to sit up straight and their shoulders are sitting forward. These are so tight because your body adapts to the position you're put in. If you've been on a computer, you've been on your phone all the time, these are all tight. Well, you literally can't sit up straight because these are so tight. Get in a doorway and do a doorway stretch to help open things up, okay? One of the other things is just doing isometrics for your neck, is trying to push your head into your hand and not letting it move. 5 seconds each way, forward and back. Do all four directions. Neck strength helps to support the neck, okay? And it also helps with neck pain. So those are like 3 simple things. Those are kind of some 3 basic ones. Chin tucks, and you do like 10 of them at a time, 4 or 5 times a day. Doorway stretch, 20, 30 seconds, 2 or 3 reps, 3 or 4 times a day. And then the isometrics once or twice a day, about 10 reps. Those are really good basic neck exercises. Thanks, Lauren.
Okay, and Josh wonders if you recommend any cervical traction machines to release pressure on the discs and to stretch the muscles.
The short answer is yes, but because we don't know your exact situation, I don't feel super comfortable just saying, okay, go buy this, you know what I mean?
Yes.
So, but we'd love to answer your question, Josh. So you can contact us. We're going to be given contact information later, or you can message us through the Facebook.
Yeah.
But we'd be happy to answer that. But because we don't know your specific situation,
right,
we need to know more to make sure that we don't.
If it's right for you. Because sometimes it's not. Sometimes it can make it worse. Yeah. But do we use those?
Yeah, absolutely.
Oh yeah, absolutely. Because we all have a compression problem. We all have to deal with gravity every day. We all do this during the day. And sometimes some people, this is what they do. They literally do this and they actually try to lift their head off their neck. They go, oh, if I just walk around like this, it just takes my neck pain away, it takes my headaches away. Okay, you're good. You may be a candidate for some traction. And there's several different home traction units that really work nice.
Well, I think you just touched upon the next question. Louisa wants to know, are those exercises also good for tension headaches?
Ooh, yeah.
Oh, tension headaches.
Because tension headaches start out back here.
Yeah, right here.
So these muscles are in a shortened position and they're hard to stretch. So if you do that waddle exercise that he was just saying and tuck that in, that will stretch out those muscles in the back of the neck.
Yeah, and right here, this area right here, guess what it refers pain to? Here and up over the head to here. Eyeball. Whenever people have like eyeball headaches or forehead headaches or stuff like that, it's a lot of times coming from this. And you get up on that high neck and loosen that thing up, and they're like, oh my gosh, my headache's gone, I can actually move. And you give them some extra specific exercise to help keep it moving in that high neck between C1 and C2, because that's where half your neck rotation happens, C1 and 2. And if we're sitting like this, remember at the beginning, if we take motion up in one direction, we lose it in the other two. Okay? So think about it, this is all crammed up in here, it just doesn't move, so it gets shortened, gets tight, trigger points, headaches, bam, right?
Mm-hmm. Bam.
That's my word for the day. Does that help? Does that answer your question? Tension headaches? Yeah. We see that. I see seriously a fair amount of tension headaches, migraine headaches, stuff like that can be a cause, musculoskeletal cause. Neck facet joints can cause headaches. Mm-hmm. When you have compression on the facet joint, that can cause headaches. So there's things you can do to help open things up and give people things to do to help unload those necks. So
I'm going to backtrack just a smidge.
Okay.
I had this happen last week. Patient came in and said, I've got arm pain, and I can only make it go away if I do this.
Yeah, we see that. You know what that is?
And so, like, without even examining her, I have about a 99% percent idea of knowing what it is.
Right. It's a nerve root impingement in your neck. And what it does, it puts slack in your nerves. I ask patients, you ever do this? They go, oh yeah, it's the only way I can sleep, or I sit in my recliner, put my hand on my head. It puts slack in your nerves, so the nerves don't have any tension on them. Because if something's pushing on a nerve root, it hurts.
Mhm.
And so you put slack in it and you go, oh, that feels better.
Mhm.
So that's a nerve, that needs to be, there's a lot of things we can do for that.
That's one we wanna get you in.
Yeah, just call us.
Yeah.
Get it taken care of. Yep.
Okay.
Any other good questions?
Got any more for us there? Okay, all right.
Is this helping? Is this good? Is this enough information for people? We want to give you some traction on some things so you know what you're dealing with. There's actually hope. There's hope. Okay.
So I'm gonna move on. And we'll still have time for more questions. In terms of when people come in and see us and work with us, and especially that person that's maybe been dealing with this for a long time, or it's really interfered with their life or their lifestyle in some way. Maybe they can't go biking with the kids anymore because it hurts, or maybe they're miserable at the end of the workday every day, or maybe because they're miserable at the end of the workday every day, they come home and they're grumpy with their spouse or their kids or something of that nature. So, in terms of, really affecting people's life, sometimes it can be something you can live with. Like what I had last week, could I have lived with that? I could have lived with that. But,
you would have been very fun to be around.
But after a while, right?
No.
After a while,
No.
it's not gonna work. So,
No.
a few days, but then a few days becomes a few weeks and a few months and so forth. Then we find this really interferes with people's lifestyle.
Yeah, don't, if I can say something, don't adjust to a new level of brokenness.
Yeah.
Okay? Don't just settle for a new level of brokenness. That's not how you were created. You're created to be the head and not the tail. Okay? You're not supposed to be under your circumstances. You're supposed to be become an overcomer. Okay? And so don't just settle for things. Ask for some help. It's okay. Just call us even just for 1 or 2 sessions, so you know what's going on and why, and then what you can do about it.
So for those watching, what I'm going to ask you, if you're watching, obviously you've got some problems that you're wanting to improve, and my question would be is what would it mean to you in your life if you were able to resolve that problem? How would it make you feel if you were able to get back to doing the things that you love to do? And that's basically what we want to cover tonight is, we a lot of times see the trickle-down effects of, we're here talking about pain, but then it's really the trickle-down stuff that really affects and changes people's lives. So I want to ask, what would it mean, say, to your family members if you were able to resolve this problem as well? And because of that, we do have one other thing that we're doing tonight besides the pillow. We want to offer anybody that is interested, that's watching, a free 20-minute discovery visit with us. We can do that via phone, we can do that via video, we can do that in person, whatever works out for you and fits your situation the best. And basically what's going to happen is we're just going to listen to your story, find out what's going on, and from that we can give you a pretty good idea of if we can help you or not. We want to know if we're a good fit for each other, and we'll tell you what we know and we'll tell you what we don't know. And if we think we're a good fit for you, we'll tell you that. If we don't think we're a good fit, we'll tell you that.
Yeah.
Here's the deal though, is since everybody's starting to get out now and be more active again, and we're through this, no, we're not through it I guess, but
I'm through it.
we're getting through,
We're
getting through coronavirus. But basically we're becoming really busy, okay? And so because of that, basically we've only got 2 of these slots that we can offer this week. So if you are interested in having one of those slots, Karen is going to type in a link for you. You just simply click on that link. Take you less than 60 seconds. It'll send us your information. We promise that we're going to do nothing else with that information other than just follow up with you. And so if you'd like one of those slots, click on the link, let us know. We'll be contacting you tomorrow. We'll have two slots available next week as well. But for anybody that is interested in that and wants to take advantage of that, we would like to offer it to you.
Yeah, and these are for
it's free.
And these are for people that are ready to do something.
Yeah.
Okay. There's a scale of change. People at different stages of change. This is for the people that are just like, okay, I'm ready to do something about this. I'm ready to get some answers, or I'm going out just on faith and just asking for help. It's totally cool. We appreciate that. We appreciate people that humble themselves and ask for help, and because that's when you find answers. That's really when you find answers. So if you're not ready to ask for help, that's cool. The seeds are planted. If in a month or 2 or 3 months you go, I think I'm ready, give us a call. Get in and let's get going on stuff. Because people are just at different stages of taking action, and that's cool. We're not pressuring anybody, but I just want to throw it out there to you. Okay.
So, if you'd like one of those discovery visits, it's really for somebody who values their health. This is for somebody who's sick and tired of being sick and tired and wants to get some change, and somebody that's not content to live and manage this with pain pills or
epidural shots,
accepting a new level of brokenness, basically, as Dr. Doug was saying. So we have people, quite frankly, we have a lot of clients that come to us that have been let down by other healthcare providers. And if you want to take a different approach or see something different,
we do things differently here.
Then it'd be a good option. And as Dr. Doug was saying, we are quite busy right now, and so respectfully, if you're not ready to make that change, we ask that you not take this slot from somebody else that is, and we respect that and don't want to be judgmental in any way. And if you just need to check us out or go to the website or watch some other YouTube videos or whatever to kind of get you ready to take the next step, we'll still be here ready for you. But we're looking for somebody that's wanting to fix and solve their problem.
Right.
So.
To get to the root of the problem, we see a lot of people, and you have symptoms, you have root issues. Okay. You can chase symptoms and treat symptoms all day, but until you get to the root of the problem, that's when the symptoms go away. And that's what we do here, is we look for root issues. My last patient, I'm number 9 physical therapists and physicians treatment-wise, and I'm number 9. I loved it. I love it. I go, how many people behind the 8 ball am I? And they go, you're number 9. I said, oh, this is going to be fun. And guess what? He's getting better. Because we're getting out of the root of the problem instead of just chasing symptoms. Not afraid to get in there and figure it out.
And if it's not something that we can help you with, we'll try to direct you to who we think is the right person.
If you need, I had a patient 2 weeks ago that let his neck pain go way too far, and he was having some serious atrophy in the muscles, weakness, changing his gait, and bowel and bladder issues. That's a red flag.
Yeah.
That's a red flag. And I saw him once, took a history to exam, and I said, I'm not going to see you. We're sending you straight to the doctor's office for some workup. Mm-hmm. And we see that. I see that once, twice a year. Yeah. But that's what he needs. I'm not going to waste any time. He needs to see somebody to get an intervention done. So at least we get him some answers and places to go. So.
How are we doing on questions, Melissa?
Well, Patricia said that more physical activity, which would help her feel better, is one of the things that she could gain by coming and getting some physical therapy. And
what to do.
Mm-hmm.
Movement. You want to do your motion is lotion?
Yeah, motion is lotion.
This is his tagline. Motion is lotion. You should get a T-shirt. Motion is lotion.
Yeah, we should actually.
We should.
So ultimately we want to keep people mobile and active and off pain pills. So if your neck bothers you less, then that allows you to get outside and be more active and exercise better and do more things and have more fun.
Yeah.
At the end of the day, we want you to have more fun.
And then Leela says, how do I cure Zoom neck?
Ooh.
Because we've all got that now.
Get off your phone.
Is that the Leela who I think it is?
Mm-hmm.
Yeah.
Put your phone down.
Text neck, Leela.
Put it down and no one will get hurt.
So, in all seriousness,
we see text neck.
So if you're down here,
I
don't have a phone in my hand, but if you're here, the steeper this angle of your neck gets,
The more compression.
the more mechanical load there is from a physics perspective. And so your head weighs about 12 pounds if you're upright. If you go into full text neck position, that load increases to about 75 pounds.
Yeah.
In terms of the amount of
Compression.
pressure that's on the neck.
So what you do is you put your phone up somewhere where you can see it, and you're here. You're
So
here.
it's more eye level.
You're here, as opposed to here. Just bring it up. Set it on something and bring it up. So, hi, Leela.
We love you, Leela.
We do.
The other thing I'll do is have people take a couple, 3 pillows. If they're sitting on the couch, a couple pillows in your lap, you can hold your phone up here.
Oh, that's a great idea.
Mm-hmm.
That's rocket science. I call that rocket science. So, that's a really good idea.
One of the
Can I
things-
use that?
Yeah, you can steal that.
Okay, that's really good. I never thought about that. See, we're learning.
Right.
See, we learn something new every day.
So we want to be respectful of everybody's time. It's about 6:40. So let's go on to the next thing, and then if people have more questions, type them in. We're going to hit that here before we go. So we said that we were going to give away one of the Pillowise pillows tonight.
Okay.
So here's how that's going to happen. If you are interested, if you would like to be the big winner of
Chicken
the
dinner.
winner chicken dinner, simply type the word pillow in the comments, and we'll give you a little bit. Just type pillow,
Pillow.
not pills.
Pillow.
Pillow in the chat, in the comments. And our crack staff, our crack team of researchers behind the scenes are frantically putting all of those names in a hat, and we're going to
Operator standing by.
draw your name.
So,
So write the word pillow in the comments if you would like to have an opportunity to win one of these, and then what we'll do is when you come in, we'll have you come in and we'll measure you, take all your measurements, and then you'll walk out with a pillow.
you got a carrying bag. Yeah, it's like going to those high-end shopping stores.
Oh yeah.
You get a nice carrying bag too.
Yeah. It's like Gucci.
Almost.
Yeah. Yeah.
No. But you get a carrying bag with it. It's kind of nice.
So while
type
we're-
pillow when you're in the comments.
So-
okay, if you want a free pillow, chance of free pillow, type pillow.
So while we're doing that, do we have any other questions we need to tackle?
Well, we do have a person who had lower back surgery in 2005, and I guess recently tried some PT, but it wasn't helpful. Apparently, they used a TENS unit and very little exercises.
Okay.
Okay.
So,
We would be more than happy to chat with you about it.
Yeah.
So if you want to click on that link that Karen's typing in the comments there, that will just take you to a page on our website. We'll get your contact info, and we would be more than happy to chat with you about that. And
Can they call the clinic?
or, we do have a phone.
We have a phone.
Yeah.
558-8808.
316.
316. Area code 316. In case you're out of the area. Area code 316-558-8808. We have operators standing by right now. Not really.
Not really. We have a voicemail.
Give the voicemail.
We have a voicemail standing by right now.
But yeah, call. Let's leave a message. Leave a return phone number. Sometimes we have people call. Hey, can you call me? And then they forget to leave their phone number. Okay. We don't have caller ID on ours, so call, leave a message. We get back with you, answer questions, and visit. Just get your questions answered. I think sometimes I think that's the biggest part is if you can just get people's questions answered. It's like, okay, good. That's okay. Because a lot of times our thinking just goes, it just spirals down to like the worst case scenario. I have cancer. I'm going to die in 3 months. Seriously. You know, that's where our thinking is. But sometimes you have to, if you can just, it says, it says in Isaiah, it says, my people are in bondage for lack of knowledge. So how do you stop being in bondage? You're all bound up. You get information, so you make a different choice, so you get different results. Okay, and so that's kind of what we do. We teach people, we listen, we educate, we understand because we've seen it, and then we help people to really grasp and see what's going on and why it's going on, and then we take them on a path to help get results with what they're dealing with. So.
Okay, do we have a winner of the Pillow Eyes?
We do, although I will let you know that Joy wanted to know if chicken dinner is second place.
Winner, chicken dinner. Joy.
Okay, our winner is Greg. I think we only have one Greg on, so I won't use his last name.
No last names. Congratulations, Greg. You got a free pillow.
Way to go, Greg.
So call us, get a hold of us, and then we'll get you on the schedule so we can measure you and get your custom pillow for you. So,
or you may use that link.
Or use the link.
Or you may message us through Facebook.
Yep.
Or you may call us at 316-558-8808. Congratulations.
Josh.
You will love it.
Yeah.
You will love it.
Yeah.
And then Josh is wondering if Dr. Doug has any good quotes on his wall related to neck pain.
We did not prepare for that. We should let people in on the inside joke.
Okay, what I do is I have a quote wall at my desk, and it's like, remember the old show, Kids Say the Darndest Things with Art Linkletter? It's the same thing in here. My patients say the best things, okay? And they say, I mean, it's just stuff that it's just off the wall, but it's really funny. And so I write it down and I save all my quotes
on a Post-it note on the wall.
Yeah. Do I have neck pain? Neck pain.
We should have prepared, Josh. We should have prepared.
I'm thinking of other quotes, but they don't relate to neck pain.
I've got one.
What's that?
I've got one. So one of my patients, it's on the quote wall. I get
all
some.
Right.
I get
a
a few once in a while. But my patient was German, and she told me a German saying. I'll probably pronounce it incorrectly, but it goes like this: "Der rested, der roasted."
Oh yeah.
Okay, and translated probably poorly, it means if you rest, you rust.
Yeah.
If you rest, you rust. So, motion is lotion.
Yeah, motion is lotion.
And
keep things moving.
Keep moving. Don't rest.
Josh, I'll get back with you on a. Is that the Josh we know?
Mm-hmm.
Okay. I'll see if I can dig one up and send it over to you. Okay. So, any other good questions? Has this been helpful for people? Has this given you some answers about what's going on or what could be going on? Some things of what to do. I mean, this is just skimming the tip of the iceberg of neck problems. But we could do it. You can do. There's like 2 and 3 day seminars on neck problems, and we're doing it in 30 minutes with giveaways and stuff like that. So hopefully it's been helpful for you folks to get some answers about what's going on, what you can do. If you have further questions, give us a call. Come on in. And we'll dig into what's specific to your situation and help you become an overcomer. Okay.
All right. So once again, we want to say thank you. Thank you everybody who tuned in this evening. Thank you to Karen and Melissa for helping behind the scenes. We hope you found it valuable. We do have lots more stuff related to neck pain on our website, bodyworksphysicaltherapy.net. Also on our YouTube channel, which you can access from the website, or go to youtube.com/physicaltherapyks. So we have lots of information there, articles, podcasts, etc. As we mentioned, if you're interested in taking one of those slots that we've got this week, just click on the link, or you can call us 316-558-8808. Once again, we want to specialize in keeping everybody mobile, active, and off pain pills. And until next time, thank you.
I am out of here.
We'll see you later.